The following scenario is intended to promote reflection and discussion about dynamics in working with Aboriginal families. As you watch, consider the following. What is happening? What may be contributing to the family dynamics? What are some strengths in how the counselor approaches the situation? What could have been done differently? If you were the counselor, where would you go next with the family?
1 minute, everything was going along as usual. Then all of a sudden, it was over. My wife, she's my life, my Annie.
I don't trust these people. My mother's not dying. If she were dying, we would have known before now. I mean, wouldn't she have been sick for a long time? No. They've made a mistake.
Me? I'm fine. I'll be okay.
The Bouchers are experiencing what it's like to be confronted by terminal illness in a loved one. Ken, Annie's son, has shut down. Jody, her daughter, vacillates between anger and denial. And Fred, well, Fred is a husband who is passive and likes to keep the peace. He puts his trust in the system. All of you are in pain, and each of you will cope with your pain in different ways.
Look, you don't know what we're going through here, so don't go getting all high and mighty with that counselor BS.
Jody, please don't start. Just sit down and try to get along.
Right. Just like you two. He doesn't say anything, and you let anybody boss you around.
Jody, everyone deals with pain differently, and we all need to feel safe to express that pain, and that means we need to be able to express ourselves without hurting each other. Please sit down. Everyone needs to feel safe here.
Here's this professional trying to give us some guidance and help, and there's Jody having a temper tantrum, just like she always does. And all I want is for someone to tell me what to do next.
I know she's gonna throw me out or tell me to shut up, just like Daddy does when I get angry.
As the facilitator for the family, it's my job to make sure that everyone is heard and gets an opportunity to speak.
What do you mean she's dying and we all need to deal with it in our own different way? Frankly, I don't think she's dying at all. And you're all a bunch of idiots.
Jody, your mother hasn't been well in months, so why don't you just be quiet now and listen to the counselor? She's only trying to help.
Ken, do you have anything that you want to say here? As I was asking you, Fred, how would you like to handle this with your wife? Would you like to talk to her about it?
I can't do it. She's everything to me. I just can't. I can't.
Could you be there to support your wife with the doctor if he did some of the explaining?
I could do that, I think.
What? You're just gonna give up like that? I'm telling you, she's not dying. And this is one terrible, gigantic screw-up.
Jody, Mom talked to me. She's been feeling sick for a long time now.
You're giving up too? I'm telling you, when she walks out of this hospital, you're all gonna look like fools.
Jody, it's good to have hope. And your hope for your mother is vital to all of your family. But we also need to look at what to do if things don't turn out so well.
What do we do next?
Well, I'd suggest that you meet with your wife's doctor, and then he can explain what has happened and what to expect. And Jody, you can ask how sure they are that the tests are right and what they can do for Anne. The decision to meet as a family with Anne's doctor is one you can all decide on. Each of you can decide what's best for you. Ken, it sounds as though your mother talks with you a lot.
Yeah, she thinks I'm a good listener.
She's likely going to need a good listener. You have a special and important relationship with your mother.
Most people are uncomfortable with my anger. I thought that counselor would eventually throw me out of her office. But she didn't. She didn't judge me or anything. In fact, I think she respected my thoughts. At one point, I even felt like I didn't want to be angry anymore. But then I was scared that if I'd stop being angry, then I'd start to cry and I'd never stop. Oh, don't get me wrong, though. I'm not giving up, you understand? I just have to figure out what's best for Mom. And I guess what's best for me, too.
I'm still not sure what to do, but I know that I have help when I need it. I worry about the kids, but I trust that they'll deal with this in their own way and in their own time.
I was afraid the counselor would make me talk, but she didn't. I guess the counselor understood me being quiet. I'm kind of glad for that. I'm kind of beginning to trust her too. I've got to go now. Mom wants to talk to me.
Generational conflict is often seen in family relationships. However, the relational or communication dynamics can have unique characteristics in Aboriginal families. While it's often a nuclear family unit that's engaged, many times there is a larger extended family which is involved as well, although not always readily identified early on. Conflict and complexity in relationships is confounded by the historical impacts of contact. A deep pattern of dependency continues, especially for many status Indian people, and the default for many, as Fred expresses, is simply to find someone to tell him what to do next. Denial, anger, mistrust, and non-responsiveness are emotions and behaviors for engaging that can be relatively common. Many of these dynamics have their roots in unresolved issues and a backlog of grief. These are associated with experiences such as residential school survival, other historic trauma, and a history of tragic death in many Aboriginal communities. These dynamics are part of the current reality of working with many Aboriginal families. They reinforce the need for patience, guidance, and ground rules to facilitate a safe space for families to work together with providers in planning realistic goals of care.